Hi, everybody. Good morning. Hey, we're really excited to be here today. Doctor on Demand is really, as the title slide says, trying to deliver healthcare and make employees healthier with lower cost. But I would also say that what we're really trying to do is create convenience, provide access. So I don't know if you folks have felt this, but I don't know why every emergency feels like it's always 2 o'clock in the morning with storming outside and rain pounding the windows. And so again, I think all of us have had that experience way back where we had to drive to an emergency room and get that coverage, right? It takes time, it's expensive, oftentimes it's unnecessary. And so what Doctor on Demand is really trying to do is just make it very easy for people to get access quickly, affordably, and again, not having to really worry. So there's that amount of time that it actually takes to get that care. People are stressing, people are concerned, they don't know what the symptoms are, they're worried about it, particularly if you're dealing with a young child. And so again, we can help reduce that. We're available in that spirit 24/7, 365. So that means that we're available on Saturday night at 2 o'clock in the morning or Saturday afternoon at 2 p.m. So we can get people care within 10 minutes and then also be able to provide lab as well. But in addition to that, they may be coming in for a medical condition, but we can also then screen for PHQ-2s, identify if there's a behavioral health need, and then also get them behavioral health support if they need it very quickly and very efficiently. And one of the things that really differentiates us from others is that we have an employed model. When we were starting out, we really tried to figure out what creates great care. We looked at national health centers, what were the characteristics of that, and that is an employed model where we can actually train the providers, make sure that there's robust quality trainings that go on and fairly consistently. And so with that, what we're able to see is 63% of patients intending to go to the ER don't because of our counseling. 83% experienced an improvement in depressive symptoms, and 95% resolved their issues without having to go to external care or to be referred to somebody else. So our everyday and urgent care, you can see some of the things that are treated. So everything from cold and flu, weight management, asthma, and we have a 96% case resolution rate. And again, as I mentioned earlier, 63% are redirected that were intending to go to an ER, and we were able to cover that. And then in addition, our physicians are cross-trained and in dermatology. So things like rashes and acne, we're able to do visuals on these folks who are coming in. And again, not having to refer to a dermatologist and a specialist. And so we're seeing 90% case rates in this area, and also satisfaction rate, member satisfaction rates at 4.9 out of 5. So what we continue to hear over and over again is how quick and easy it is to get care. And even the people who were coming by the booth today, there were some great stories of people who were saying, I was terrified. Somebody even said, my fingers were turning blue. I was ready to go to the emergency room. And I called Doctor on Demand, and within 10 minutes understood that it wasn't something that was life-threatening. I didn't have to go to the emergency room. They were able to get medication and resolve the issue. So again, really being able to address care and provide support when people need it. So mental health, right? I think there's a huge mental health crisis in the U.S. 47% of adults are reporting symptoms of anxiety, 39% symptoms of depression, and then 1 in 5 adults experience mental health issues each year. All this is taking place while access is getting more challenging, time to care is getting more challenging as well. And so this is one of the great things too about Doctor on Demand is, again, they may be coming in for an urgent care issue. We do a PHQ-2 and then can refer. Typically, we're getting them care within 3 business days. And we have the ability to do things ranging from just therapy to serious mental health issues as well. So again, access, ease of care. And you can see some of the things that we're covering. So not only stress, sleep issues, but also anxiety and depression, substance and use disorders, as well as serious mental illness issues as well. And we have a pretty great success rate. One, I think getting behavioral health via the phone or via a consult, a visual consult, we're seeing an 83% of members who experienced an improvement in depressive symptoms after 8 therapy visits. 40% saw an improvement in the PHQ-9 scores, and 76% of members experienced an improvement in anxiety symptoms as well. And then with psychiatry, it's tracking very similarly, right? 86%, 47%, and 80% there. What we wanted to do is also just kind of outline how easy it is for somebody to get that help. So here's Allie's health story. She has a history of asthma. She uses an inhaler. She's concerned with the cost of healthcare. She's still paying for medical debt from a knee surgery from a few years back. She finds healthcare to be draining emotionally and financially. She would rather not deal with it, but also believe that she needs to take care of herself in order to be there for her family. She's introduced to Doctor on Demand through an open enrollment communication from her employer. And so this is what happens. Through that flyer, she's able to download the app and creates an account. From there, she does an intake form where we're able to get information specifically. She thinks that one of her kids had brought home a bug from school, not uncommon, as we all know. And then through the intake process, she's able to register within a couple of minutes. She has that urgent care visit very quickly and seamlessly. She's seen by a clinician within minutes. And then based on that and based on the assessment, Allie's got a prescription to help with her cough, and it's sent to her PCP. She picks it up at an integrated pharmacy, and then she's able to return to work after a few days. She's feeling much better, and she's back to work and able to kind of juggle everything as a busy mom as well. So again, I think just to summarize, quick and easy access, the ability to get care quickly, not having to go to an urgent care center or an emergency room, taking the fear out of conditions when they arise, being able to identify and be able to direct to behavioral health help when maybe there's not even an awareness for that as well. And so again, what we really want to promote is, again, that access, speed, and quality of care. Thanks so much.